innovation. So we move on to our next talk, and it is by Dr. Shebin Salim. She's a budding oculoplasty surgeon from Giridhara Institute, very active in all conferences, and she's going to talk about abnormal head posture due to diseases of orbit and adnexa.
Thank you, Dr. Nina, for your kind words. Good afternoon, all. We'll directly go to the presentation. So this is a 4-year-old girl who presented with the right eye severe ptosis since birth. Her visual acuity is 6/6 in both eyes. So the chinna posture that she is having, this helped her to have a binocular vision and prevented visual deprivation amblyopia in the right eye. This is simple congenital ptosis. Next, we have a 4-year-old boy. Actually, this patient presented to us at the age of 1. He had bilateral severe ptosis. We can see that there is telecanthus, blepharophimosis. This is BPS, blepharophimosis, ptosis, epicanthus inversus syndrome. So, despite bilateral severe ptosis, we waited till 4 years of age for the ptosis correction because there was no amblyopia, and the chinna posture helped to prevent the amblyopia. And we waited till 4 years of age to get a better soft tissue development. This 12-year-old boy presented with the left eye mild ptosis since birth. So here we can see that he is having a left hypotropia and elevation restriction in the left eye in all cases. So this is monocular elevation deficit. Here the ptosis can be pseudotosis because the lid follows the globe, that is down, but in 25% of cases this can be true ptosis. So this is another lady who presented with a progressive bilateral ptosis since past 20 years. So here we can see that in other than bilateral ptosis, she is also having a generalized facial muscle wastage. So this in her there is progressive, both extraocular movements are restricted, bilateral symmetrical. So this could possibly be an isolated CPO, but before diagnosing it, we have to rule out other causes of progressive myopathy, including paraneoplastic syndrome. So this is a 3-year-old girl who is having squint and an abnormal head posture. So we can, she is having a face turn towards the right side, mild chinna posture. So here again, she is having a elevation restriction in the left eye only in adduction. So this is Brown syndrome. It is a form of restrictive strabismus where there is mechanical restriction of the superior oblique tendon trochlear complex. So in subtle cases of Brown's, the squinting can even be missed. So this boy again presented with an acute onset squinting. So here we can see that he is having an elevation restriction in adduction in the left eye. So this was a case of acute Brown syndrome. So first we did all the blood investigation to rule out the possible etiologies of acute Browns, and the imaging showed soft tissue, minimal soft tissue thickening at the region of the trochlea on the left side. So initially we tried a course of oral steroids, but no improvement. So we went ahead and did a small incisional biopsy from the trochlear region and an intratrochlear steroid injection. Incisional biopsy only showed non-specific inflammation. This is at the end of 8 weeks with oral steroids and intralesional injection, he improved completely. So this girl, can you see the abnormality here? So she is having a prosthetic eye on the left side. So possibly there is a face turn to the left eye, maybe for a better field of vision. So that is, it's not seen in all the patients' anophthalmic socket cases, but some patients we see this abnormal head posture. So this 63-year-old gentleman, he presented with the acute onset drooping of left eye. So here we can see that imaging, there is enlargement of the left superior rectus and LPS muscle complex with an adjacent lacrimal gland inflammation. So here he is again adopting the chin up and face turn. One is for a better field and also to get vision with the left eye. This was another interesting case. He presented with acute onset diplopia and right eye drooping. So cover test for both distance and near showed a left hypertropia which was increasing on right gaze and left tilt. So this is left superior oblique palsy. Extraocular movements are full. So eyes test was positive. So possibly this is a case of ocular myasthenia. He was sent for further investigation. Usually in myasthenia, the recti muscles are involved. Oblique involvement is very rare. So this was a 14-year-old girl. She is having a chinna posture, but whenever we take photos, we actually correct the head posture and take. So here we can see that she is having a complete elevation restriction in the left eye. Imaging showed, this is MRI imaging, sagittal showing a large cyst in the inferior rectus muscle. So this was inferior rectus myocystic This should be treated with oral albendazole and steroids for 6 to 8 weeks. So, and it is very important to start treatment as early as possible in these cases to prevent fibrosis of the extraocular muscles and residual diplopia. Again, similar case, cysticercosis of the orbit. So here we can see that the cyst is lodged between the optic nerve and the medial rectus muscle. So the child is having face turned towards the opposite side. The right eye, there is adduction restriction. So this is after treatment, there is complete improvement. So this was this lady, in fact, initially presented with a sight-threatening thyroid eye disease, and she was treated. Then she developed cataract. Following cataract surgery, she started having diplopia. So we can see that she is having right esotropia and a slight face turn towards the right side. She underwent squint surgery. So this was a 5-year-old girl who is having an abnormal head posture from birth. So this, she is having a plagiocephaly on the left side. So flattening is here. So what happens here is there will be shortening of the roof. This in fact causes a superior oblique deficiency with the desagittalization of the images. So to overcome that, the child will adopt a head tilt. Because of the head tilt, there will be there will be hypoplasia, facial hypoplasia. So this can be prevented if we do an early surgical intervention before 3 years of age. Another interesting case of orbital floor fracture. The child is avoiding the right orbital floor fracture with inferior rectus entrapment. Child is avoiding the maximal action of the inferior rectus muscle, that is a down and out position. So this gentleman, he had a frozen globe on the right side. He presented with the complaints of diplopia. He has a chinna posture. So we can see there is a inflammatory mass on the inferior and middle aspect of the orbit. So this incisional biopsy was done. PCR was positive for tuberculosis, treated with ATT. Then he had a recurrence. Again, biopsy was done, which showed only fibrosis, which we still don't know the diagnosis exactly. But his ocular movements did not improve. So this is golden horse syndrome, that is oculoauricular vertebral dysplasia. Here the abnormal head posture is not exactly due to the ocular condition, but because of the vertebral anomalies. So a lot of conditions including ptosis, monocular elevation deficiency, Brown's, inflammatory conditions, parasitic, anophthalmic socket, fractures, all these can cause abnormal head posture. So whenever we see an abnormal head posture, we have to evaluate for it. Thank you.
Thank you, Shebin, for that excellent demonstrative cases. And now we know that there is always a reason for the head posture.